And so our next speaker, on behalf of 4 other collaborators as well, is Jacqueline Avanthay Strus. Jack is professor in the School of Nursing and Health Studies at the University of SAINT-BONIFACE in Winnipeg. She's the past president of Canadian Association of Nurses for the Environment, CANE. Also has a French acronym, which I won't try to pronounce in French, and is currently completing doctoral studies at the University of Ottawa. So Jack.
Hi, thank you so much for having me here with you guys today. I apologize, there's technical difficulties, so you guys will not be able to see my face. But as I was introduced, you guys can call me Jack. My name is pronounced Jacqueline Avanthay Strus. It may be hard for people who don't speak French or Italian or Ukrainian to pronounce, and I forgive you guys already. So I come on behalf in my role at CANE, and to kind of center ourselves, I just want to let you guys know that at CANE, we commit to righting the wrongs of colonialism by strengthening our knowledge of and relationships with our Indigenous peoples where we live, work, by adopting decolonial and anti-racist practice and discourse. I would also like to acknowledge traditional and present-day Indigenous knowledge systems that have long recognized humanity's interconnection with nature and understood how to protect and preserve those lands and live within the capacity of sustaining life. I also want to acknowledge that I hail from La Frontera, or borderlands, growing up an intersection of Métis, Anishinaabe, French, and English cultures, and consider myself of many peoples. I am coming to you today from Treaty 1 territory, the lands of the Anishinaabe, Cree, Dakota, Dene, Oji Cree nations, and the homeland of the Métis Nation. So today, the project I'm going to present is more of a hands-on project, which is a little bit different than the research projects you guys have seen. So what happened and how the heck did we end up creating this toolkit? So essentially we were approached by the Canadian Federation of Nursing Unions, and we're in a little bit of a predicament because, as you know, nurses work a lot. And as Jess had mentioned, we are overburdened, especially during the pandemic. But there was definitely some moral distress happening amongst nurses when it came to the planetary health crisis. And they wanted to be able to engage actively in mitigating the effects of the healthcare system's role in climate. And so anybody who's worked in this area, we'd love for you to reach out to us. So this basically stems from like a partnership that we've had with the CFNU, as I mentioned, and they published a really awesome paper called Climate Change and Health by Wanda Martin and Lindsay. They're 2 CANE members as well. And this article gave some guidance, but as we know, nurses who work frontline, it's not like they're given time to read articles. So we figured let's do some knowledge translation for them and show them like practical things that they can do to address planetary health crisis in hospitals. And so before I start, I want to acknowledge the fact that I was the project lead for this project, but it wouldn't have been able to come to fruition without Fiona, Hanley, and Joanna, the co-coordinators of this project, as well as Katie North, Émilie Tremblay, Lisa Larkin, Lindsay Komar, Laura Rafrashid, as well as expert advice we received from Lori Harden, who is the co-chair of Hospital's Green and Healthy Committee and member of the ALBERTA Health Services Environmental Sustainability Committee. This is huge because that's one of the first leadership positions in sustainability that a nurse has taken in Canada. Many more has come since then. And so this toolkit came because we wanted to really help nurses be able to act in a meaningful way to support individuals, families, communities in facing planetary health risks and learning how to reduce the risk and adapt. And we also know that because the healthcare system is one of the largest GHG emitters, we want the healthcare system to become even more resilient. And so we decided to frame it in a planetary health nurse perspective. So the presentation today will pretty much take you kind of step by step through the toolkit, and that way you get to decide if you want to read it further or not. So essentially, like I said, it's to guide hospital nurses to respond to the planetary health crisis. We have hands-on paper copies that CFNU has created. They're both in French and English. And there's also a full digital version. And for practicality sakes, because in tertiary healthcare, a lot of the focus is on the sustainability, that's a lot of what we focused on. So the first part of the toolkit is basically what nurses need to know. And so this is where we have to have it written in a way that everybody who works in tertiary care centers could see themselves in this, because we know that the roles of nurses, level of knowledge about climate change is very extremely varied. We also know that there will be nurses who are like, yes, I want to engage at a system level, an institutional level, and policy levels, where other nurses will be more like, how do I do this in my direct patient care or on my unit? So we wanted to make sure to have a range of opportunities for them. And so we made sure to integrate climate science basics as well as planetary health. And then we don't want to, with the whole eco-anxiety, moral distress, we wanted to give as well, like, situated in nurses' role, right? And the other thing we wanted to frame it as, it shouldn't be something added on to nurses' role. It should actually be part and have positions where nurses can do this work in paid positions. So then what are nurses able to use and work with? So we made sure that it was like day-to-day and patient assessments, teaching, discharge, as well with families and communities, but as well as keeping an eye on equity denied populations. So people who face multiple vulnerabilities because of the environment in which they grow. And then we also wanted to make sure to give concrete interventions. And then the other thing as well we wanted to look at is what's happening right now that we can do easily to integrate. So for example, I don't know if you guys have heard of the Gloves Off campaign, or even the push towards the climate conscious inhalers. Those are two concrete things that don't actually take a lot of work, but it does require intersectoral collaboration and interdisciplinary collaboration. We also wanted to have it like individual and unit levels. And we know that, especially during the pandemic, nurses, when it came to single use, like plastics, pharmaceuticals, personal protective equipment, it was really difficult knowing that I know we're saving this patient in front of us, but we're also making so many other people sicker because of what we're doing. And then I also, there's a few other things as well, was that we also wanted to make sure that nurses were able to identify like the level of personal protective equipment they needed with the increase in communicable diseases, as well as vector-borne diseases as well. But we also wanted to make sure that nurses were equipped to understand policies and be able to influence these policies at the provincial, territorial, and national level. But we know that nurses don't have as much practice with this, so we made sure to integrate as many resources as we could. And then like just little random examples that we put. So for those of you who've been in a hospital, you know that there's biohazard waste. And when you're changing a dressing change, often we think we have to get rid of everything that we use to change this dressing, but we really only have to put the bandage that was closest to the skin. That reduces the need for the incineration. That also increases the pollution. So the other thing is, if you can see here, this is an example of Rocky View Hospital in Calgary. So just increasing proper signage actually increased a lot of nurses just becoming common practice to do these different things. And the other thing as well is, as a lot of the other speakers mentioned, climate work and planetary health work is like a marathon, not a sprint. So it also is important to engage with others who are like-minded so you don't get drained. And so we wanted to make sure that in doing so, they had opportunities to join these other people, such as the Canadian Coalition for Green Healthcare's the hospital scorecard. But we also wanted to give them like concrete things like example emails, letter to the minister, what can you write? And the other thing as well that we tried to do was really integrate like that advocacy from multiple levels. So for example, from the union perspective, from nurse management's perspective, et cetera. As well as looking more at the circular economy as well, because we saw a lot of shortages during the COVID-19 pandemic. And that is all for me. So just a reminder that the toolkit is available, both French and English. There's a full digital version. And yeah, I can take questions now if you guys want.
Thank you very much, Jack.
Hey, hi, Jack. Thank you for that fantastic presentation and the work that's gone into that. Can you give any, like in terms of the toolkit, do you have any knowledge about where it is actually being used now, and what's the uptake? Because it's
so the uptake definitely varies. So from the toolkit, we were able to create a coalition of healthcare providers interested in sustainability. So now we have a Pan-Canada Sustainability Committee that is a nursing-led work. So nurses that read the toolkit contacted Kane. We created this committee. So we have around 50 healthcare providers working in this area. So now we're doing advocacy at the local levels, like meeting with the sustainability offices. We're meeting with the ministers of health. We're organizing breakfast with the ministers. We're also meeting with key players in the government of Canada, like Dr. Lee Chapman, who's moving this forward at a higher level to like look at sustainability from like a top down. We're also moving towards like the accreditation piece for hospitals, so that they actually, part of the accreditation piece would actually be the green scorecard and actually keeping that into consideration. So that's one of the ways that it's been there's been an uptake. Another way that there's been an uptake is schools of nursing have found this toolkit. And so they've started an initiative, Greening the Nursing Labs. So the first uptake was in Alberta with Mount Royal, MacEwan, and U of A. And so they'll be sharing what they've done shortly. From there, and inspired by there, we now have the first cohort of BC Planetary Health internship in cancer care, which is fantastic. So we were able to get funding from the hospitals to actually have nurses take 12 weeks off to do a planetary health initiative. And we have enough funding to do 3 cohorts of them. So like you can see that the uptake and like people seeing this and talking about it makes a huge difference. So it's being used as resources for those types of programs as well, which is awesome. I didn't really expect that, right? Like from that. I could probably go on for another 30 minutes.
I know, but I really wanted you to share that because it gives such practical things, right? That when we think about our nurses out in practice. Thank you so much. Thanks, Jack.